For many years, GIZ has been working on behalf of the German government and other commissioning parties for sustainable development and improved living conditions in partner countries worldwide. The COVID-19 pandemic has demonstrated the importance of long-term cooperation with national and regional partners and has shown what is possible when we work closely together to overcome a crisis. Especially in the area of health and social protection, GIZ, on behalf of the German government, responded quickly to partners' needs. We would like to tell the story of a few of them. The ID Poor program is Cambodia's registry of all poor and vulnerable households nationwide. The registry has been built with long-standing technical support from GIZ for over 10 years, funded by Germany and Australia. It allows almost 3 million Cambodians who are most in need to access services tailored to them. While Cambodia initially managed to limit COVID-19 infections and deaths, the economic impact of the pandemic was immediate and devastating. Many Cambodians work for low wages in garment factories, on construction sites, or in tourism. The pandemic strongly affected these sectors. Jobs simply disappeared, and many people are still without a dependable income. In this emergency context, GIZ rapidly adapted the ID Poor system so that everyone could register on demand and new hardship cases would not be left behind. Simultaneously, partners such as UNICEF paired each registration with an e-payment account. In tandem, over 700,000 additional affected people registered with new mobile tablet devices during the pandemic. Together with those already in the registry, ID Poor reaches roughly 15% of the entire population. The availability of a system with such scale allowed the Cambodian government to take an unprecedented step. Everyone on the ID Poor registry would receive a monthly cash transfer to protect their livelihoods from the economic fallout. For over 2 years, the ID Poor COVID cash transfer has been a lifeline for poor and vulnerable Cambodians as they persevere through this pandemic. In total, the Cambodian government has handed out about 750 million euros in direct cash assistance, made possible by long-term system building, trustful cooperation, and bold decisions hand in hand with GIZ. These were not the only emergency interventions that GIZ has supported. In addition, when severe lockdowns were put into effect, GIZ rapidly extended the app used for interviewing beneficiaries to take into account acute COVID-related hardship factors. Within just 2 weeks, about 250,000 people registered for targeted assistance. GIZ also collaborates with the World Food Programme, providing 5 million euros of COVID funds from Germany to extend cash support to vulnerable households suffering under both COVID-related economic hardship and acute climate shocks, such as floods. The GIZ ID Poor project thus combined long-term cooperation and a digital approach to have a lasting positive impact during and beyond this pandemic. For our last project, we visit Togo. The health program in Togo focuses on health system strengthening, reproductive health, and sexual rights. Due to the underfunding of the health system and the poor quality of health services, utilization of health services is low. This is also evident in the area of sexual and reproductive health. Less than 25% of married women use modern family planning methods, and only around 60% of pregnant women attend 4 prenatal care appointments. The goal of the program is therefore to improve access to and demand for high-quality healthcare, particularly in the area of sexual and reproductive health. However, the COVID-19 pandemic increased the fear of being infected and made people even less likely to visit a health center. In addition, the pressure on healthcare providers increased due to extra training and activities. The efforts during the pandemic were and still are as diverse as the program activities before the pandemic. The COVID-19 case management was supported with the procurement of equipment and supplies, and while many of the regular prevention and health promotion activities had to stop initially, some could resume after providing vaccines to the participants. Two other interventions supported NGOs in protecting vulnerable populations and combating fake news. One of them is Handicap International. With the support of GIZ, Handicap International provides food kits, hygiene and personal protection kits, family planning counseling, and basic health care to people living on the streets and those most in need. Another project that was subsidized was the project Togo Check, created by the Web Observation and Analysis Center, COA Web. Togo Check produced videos containing reliable information designed to fight the many misbeliefs and rumors about COVID-19 and providing important information that people could rely on. You see many activities to restore certainty in uncertain times, but there is still a long way to go. The presented programs and their measures in the COVID-19 pandemic showcase only some of the enormous global efforts and achievements of GIZ in supporting health and social protection systems in the wake of the pandemic. If you want to find out more about other GIZ projects and what they have achieved during this very intense time, watch episodes 1 and 2